Life. It goes on. It speeds by. In fact, the scenes you are witnessing in front of you almost seem like a usual, everyday experience in any large metropolitan city. Usual until you slow down a bit and see what makes this picture a different one. Children suffer from thalassemia, others from hemophilia, aplastic anemia, and a range of other blood disorders, and visit the clinic on a regular basis seeking treatment. It can be simply defined as the inability of the body to produce adequate amounts of hemoglobin in the red blood cells. The result? Severe anemia and other growth complications.
Anemia is one of the most common genetic disorder in Pakistan, and 5 to 7% of our general population, they carry thalassemia trait, which by itself is not a disease, but what happens when two individuals who are thalassemia carriers, when they intermarry, their children will have a chance of having full-blown Thalassaemia Major, which is a lifelong disorder diagnosed around 1 year of age, and these children require blood transfusion to sustain their life.
Then in Pakistan, thalassemia or other blood diseases are considered that child is not going to survive. He will die ultimately. But our organization, Umair Sana Welfare Foundation, is working on the concept that we know maybe the life expectancy of these kids is not as long as a normal person, but every coming day of this kid should be better than the previous day. Every new day should not bring a new misery in his life or his family.
Research, education, and spreading awareness are vital support systems in the prevention of a disease. The way to avoid thalassemia altogether is to prevent the birth of an affected child. Prenatal diagnosis, or the ability to detect abnormalities in an unborn child, has been used for more than 3 decades.
Prenatal diagnosis means if a mother is pregnant, if a mother of a thalassemic child is pregnant, if we check her by 10th or 11th week, her tissue check, then we can, with a PCR-based gene mutation, which we performed in our institute here, we can inform the family that the coming kid has thalassemia or not. And alhamdulillah, we have taken fatwa from Mufti Taqi Usmani that if the child has thalassemia, we can abort the kid. So in this way, we can place a barrier, and we can stop the further any birth of the thalassemic child in the same family. And alhamdulillah, this is not we are doing abortions. In fact, we are giving birth to more kids, because there were many families who decided we are not going to plan pregnancy now because we have thalassemic kids. We counsel them, we educate them. Now they have 2 or 3 healthy kids in their family.
Perhaps the strongest support the children receive during their daily transfusions is a distraction of normal, everyday activities. The foundation works towards rehabilitating these children back into society, organizing fun activities and outings for them. The children who are treated at the Umair Sana Welfare Foundation are given life skills, far beyond what any book or school can teach them. And the question here is, what can you contribute to the future of these families? What hope can you bring to these children? What can you do to be a part of the big picture here?